Today we're going to talk about some of the more common mental health problems faced by adolescents and young adults on Mental Health Minute with Kim. As I've talked about before, adolescence and young adulthood is a time of huge change for people. We start going through puberty. We start moving away from our parents in a bid for independence and want to be autonomous and form our own relationships with our peer groups. We may be starting middle school and high school or graduating from those, starting college or graduating from college. There's so much going on top of the brain development that we've talked about, that life can be hard at that point. And did you know that 50% of mental illnesses manifest by the age of 14 and 75% manifest by the age of 24? That's that period of adolescence and young adulthood. Some of the more common mental health problems that people of that age group run into are depression, that's the number one, anxiety over all of these changes going on, low self-esteem. Boys tend to have ADHD and autism spectrum disorders more than girls. That's not to say that girls don't have them. A big one for girls is eating disorders, as their body image is changing and they're trying to fit in. People in this age group may or may not have the coping skills needed to navigate this difficult time. They may turn to things like self-harm in order to feel something or feel nothing. If they have emotions and events and situations happening that are just too hard for them to handle, they may also turn to substance use. And substance use disorders are on the rise in this age group because of lack of healthy coping skills and also peer pressure, as we know. Also, suicide is the second leading cause of death in this age group. That's ages 15 to 24, and it's second only after accidents. So things to keep in mind when dealing with adolescents or young adults is to listen. That's the major one. Listen to them and also observe. If you notice changes, you notice that they're isolating or that they may be substance affected, or you notice some kind of self-harm, talk to them and listen and ask them what's going on. Validate these difficult times and the feelings that they're having. Model good coping skills and help them to establish them. And above all, if you think they need help, please get help for them. That's it for this week. I'll see you next week.